There's a lot of talk these days about, the COVID viral infection and what patient populations might be more susceptible to contracting that infection, or if they contract the infection, does it go harder on those patients? So this brings up the topic of smoking cigarettes, and of course vaping, and then of course, smoking marijuana. There are a couple of interesting studies out just in the past few weeks that actually reference the effect of smoking, any of these substances, the vaping or the marijuana, on the susceptibility of people to sustain the COVID infection and how severe that is. The act of smoking itself, the putting an object near your face or into your mouth with your hands, is going to introduce viral particles from the surfaces around you to your mucous membranes of your mouth. So your susceptibility to contracting the virus is increased just by the act of smoking anything. Smoking in and of itself reduces your immunity. Specifically, the way that works is on the little cells that line your respiratory epithelium. There's little cilia. Cilia are like little fibers that are moving with little tails, and they cause what's called clearance of mucus through something termed the mucociliary elevator. And this clears mucus and bacteria from your lungs. Smoking anything at all, whether it's vaping or tobacco or marijuana, paralyzes these little delicate cilia, and it impairs your lungs' ability to clear bacteria and mucus. People who smoke any substance at all are actually more susceptible to the COVID-19 infection. Some very interesting work in the British Respiratory Journal that just came out recently demonstrates that smokers have increased angiotensin converting enzyme 2, called ACE2, receptors on the cells lining their airways. So what does this mean? ACE2 receptors are found throughout the body, and they help with the regulation of blood pressure and some other complicated reactions. It's also kind of a bad coincidence that the COVID virus enters cells through the ACE2 receptors on the lung cells inside the lung pathways. So if you have smokers, studies are now showing that there's an increased presence of the ACE2 receptors on the surface of the lung cells, therefore increasing the ability of the COVID virus to enter the lung cells. A very interesting study just came out in the New England Journal of Medicine looking at many patients in China. And they looked at the demographics, meaning what types of habits these people had and where they came from. And they compared patients with serious infections to not so serious. And one thing they looked at is the endpoint of either being admitted to an intensive care unit or being placed on a ventilator or death. And they compared populations of patients with a history of no smoking versus severe heavy smoking or lung disease. And not surprisingly, they found that patients who had a history of heavy smoking or lung disease had greater than twice the risk of being admitted to the intensive care unit, being placed on a ventilator, or dying. Anyone who smokes more than a pack of cigarettes a day for greater than 10 years is considered a heavy smoker, but that's not to say that lighter levels of smoking don't cause problems, because they do cause respiratory irritation. They will continue to introduce the virus particles to the face and the mucous membranes. A lot of even light smokers have a dry cough, which nowadays you are trying to interpret symptoms in patients. And if somebody with a dry cough shows up after smoking some marijuana with a little bit of disorientation, a change in mental status and a dry cough can be very confusing to healthcare providers. So again, any smoking at all is really placing you at increased risk in the current conditions. So people say, what do I do while I'm home you know, during the COVID viral recommendations of not, you know, going out in public. Well, some people think that this might be a good time to start smoking marijuana to relax them, but it's probably the worst time for the reasons we've talked about, the introduction of virus particles and you know, unpredictable reactions when starting a medication, whether it's legal or not legal. Not a good time to start smoking marijuana to calm your nerves. Best recommendation is continue to eat a healthy diet and exercise, get out, get some fresh air, and by all means, this would be a great time to stop smoking and just focus on yourself, focus on your diet, focus on your exercise. Stay safe, don't touch anybody.